Okay. Good afternoon, everyone, and welcome to the PCAL webinar for the HV3 assessment, the concept map and question answer assessment. My name is Suzanne D'Souza. I'm one of the PCAL tutors on the Parramatta campus. Let me begin by welcoming your campus coordinator, Lauren Metcalf. Hi, Lauren.
Hello.
Thanks for being here today. Lauren will be advising us on content expectations for this assessment. Also with us is Marian Martin, another PCAL tutor from Campbelltown campus. Hi, Marian. Okay, this webinar is being recorded and will be uploaded to your view site. The purpose of this webinar is to explain to you the expectations, the requirements for this particular assignment, the concept map and the short answers. Before we launch into the webinar, let me just briefly orient you to how the webinar works. Now, you can see us, you can hear us, but if we ask you questions, you won't be able to verbally respond to us. So what you need to do is type your responses in the chat box. So could I just get you to respond to this question in the chat box? If you found the chat box, can you respond, please? All right, that's right, John. So it's 1,500 words in total. The concept map is 250 words and 1,250 words for your question answers. Okay, well done. Lauren or I will be monitoring the chat box. So if you have any specific questions, you could type in the chat box and we will respond to your queries. But please remember, I'm not a nursing tutor, so I'll reply to any literacy queries and Lauren will guide you with regard to nursing content. Okay, to check your comprehension, at times we might also get you to raise your hand. So could you please locate the raise your hand button, please, and click on it? All right, thank you, everyone. So we know how this webinar works and I think we're ready to roll. Okay. Now, for this particular assignment, you need to develop a concept map and answer 3 set questions. What's the topic for your concept map? Can you type in the chat box, please? What's the overall topic? Acute severe asthma. That's right. So please make sure you know what topic you're working on. So it is asthma. And I think we have some technical terms. Is that right, Lauren?
Well,
John's written.
Asthmaticus is it's more severe than acute severe asthma. So that is someone that is very sick and would be intubated and ventilated rather than acute severe asthma.
So it's a difference in terminology.
So it's further along the disease progression. So we're not quite there yet with Jackson. Okay, so John, please follow Lauren's advice and use the term acute severe asthma. John, if you got that, can you raise your hand, please? All right, thanks, John. Okay, everyone, so you need to develop a concept map and answer 3 set questions. Lauren will be guiding us as to the content for each of the 3 questions. We'll come back to this. Now, in order to prepare for your assessment, the first thing you need to do is use the pathophysiology template, which is on your view site. And in just a moment, I'll direct you to your view site. So on this template, you need to first research about acute severe asthma and collate information and put down information on this particular template. So let's take a look at the template. Lauren, are you able to view the view site as yet? Yep.
Okay. So if you click on Assessment 2, and scroll down to the pathophysiology template. Lauren, are you able to view the template?
Yes.
Okay, everyone. Now, this is the template. This is a sample template. This is not on your topic, okay? Your topic is not stroke at all. It's acute severe asthma. So this is a sample template, but it has a lot of side headings to guide you with your research. So once you've researched your topic, please put down information under these side headings. So just looking through the side headings, put down the disease, the name of the disease, the definition of the disease, etiology, pathogenesis, clinical manifestations, diagnosis, treatment, course of disease, prognosis, prevention, and also references. Now, this template is not being assessed, okay? You don't need to turn in this template at all. This is to help you be more organized, okay? So you collate all your information on this particular template under these side headings, and then you transfer the information from the template onto the concept map, okay? And use the information on this template and additional information to answer the 3 questions. So everyone, I'd like to reiterate, the template is not being assessed. That's just to help you, okay? To help you organize, collect your information, and put it down in one place. Have you all understood that? Can you raise your hands if you understood? Okay, before you will...
Susan, can I say something?
Yes, definitely.
Can you scroll down the 4 pages? Okay, so there's 819, there's 1,000 or almost 1,000 words here. So this is too much information. This is a good place to put your information and then be able to take away what you really don't need to include in your concept map. So it gives you an indication with having a word count on this Word document, and then you can pick what you need to include and pop it into your concept map. So it's a good place to collect all your information and have it under your heading so you know what you can include. But as you can see, with having sentences rather than just points, it's going to bump up your word count. So just be mindful of that.
Thanks, Lauren. There's a question, do we need to define it? That's from Anisha. And Anisha, if you look at the template, there's a definition required. Is that right, Lauren?
Yes, and if you have a look at the concept map on stroke as well, so just prior to that in views, there was an actual concept map template, and you'll see that there's a definition there as well for the stroke. So yes, you need to include a definition.
Thanks, Lauren. So everybody, this is your first step, or this is your second step rather. The first step is to do research on your topic. The second step is to collate information and put it down on this template, which would serve as a handy reference for you. And as Lauren said, there's too much of information here. You will just pick and choose what you need and insert it into the concept map, as well as use it in your question answer. Now, Lauren, are you able to view this?
Yep.
The PowerPoint?
Yep.
Okay. So when you're preparing for the assessment, like we just said, you need to organize information in your template. That's your first step. When you create the concept map, as you can see, it's a high weightage, 25 marks out of 80. And then that will be broken down to the overall 40%. Is that right, Laura?
Correct.
Okay, so this assignment is worth 40%, everyone, and the concept map is worth a lot of marks. So please put in a lot of effort in the concept map. So the concept map needs to be computer generated, and the format, it has to be size 10 font, Arial, or Times New Roman. Those of you who've already started working on your concept map, take a look at your font as well. Concept boxes linked using lines and linking words. So because of the limited word count, you could use arrows or symbols, lines, boxes, etc. And you cannot use too much of information. So you're going to use the information in point form in your concept map. The map needs to be visually stimulating. So people should need to read it, okay? So make sure it appeals to those who are going to read it. And the word limit for the concept map is 250 words. I repeat again, it has to be computer generated. It needs to be visually stimulating. Word count 250 words. In terms of referencing, on the concept map, you're going to use numerical referencing. And we'll talk about that in detail, okay? So as of now, you know you need to do a computer-generated concept map on your topic, acute severe asthma, and you could put down points. You don't have to write complete sentences on the concept map because you're going to run out of words. The word limit is 250 words, and you need to use numbering, so numerical references. How does your concept map look? It's here, and it's also on your view site. So, Lauren, are you able to look at the view site now?
Yes, yeah.
So if you go to your view site and click on Stroke Concept Map, okay, this is a sample concept map. This is how your concept map will look. But of course, that's not your topic. Stroke is not your topic, everyone. Last year, a few students whom I saw left that heading there, and they had the information about whatever else, okay? So make sure you relate it to your topic. Remember, we looked at the template, we looked at the headings on the template, and you'll find that the headings are the same. So etiology, pathogenesis, clinical features, and can you see the arrows? So you use arrows to show the relationship.
And
So
it's important, Susan, for them to use the words as well as the arrows, so you can see etiology causes the pathogenesis. So those linking words are important when we're marking, so we know that you understand the relationship. And also back to the definition, you can see under ischemic stroke, there's just a one sentence definition. That's all we're after, just to show that you understand the concept that you're talking about.
thanks, Lauren. So please follow Lauren's tips. Put it in boxes, put the information in boxes. And Anisha, remember you asked about the definition? That's all you need, a one sentence definition. Use arrows, and Lauren recommends you use these words, causes. So about that arrow, causes, then you go on to pathogenesis, arrow, results in, and then clinical features, diagnosis, treatment, etc., course of disease, influences, prognosis, primary prevention, risk factors. Please use these side headings and follow how this map is set out so that you ensure you cover all the information that's required. Lauren, there's a question from Bayan. In the tips for the concept map, she said start from causes and it must be 8 boxes.
I didn't hear that. Right, was that in the PowerPoint with Joan talking you through it? Because I didn't hear that that it had to be 8 boxes. I'm not sure where that came from, but if that's written down somewhere, okay. I listened to that again today and I didn't hear 8 boxes. Listen, if you need to have more boxes, then I'm sure if you etiology, pathogenesis, causes of the disease. So, well, causes means etiology, so it's the same thing. But if you need more boxes, then you can always use more boxes, and you don't. That should be fine, John. That should be fine. You don't have to use this concept map that's actually on your screen at the moment. You can cut and paste into this if you want to, but if you're handy on the computer and you're able to create your own, then by all means go for it. It doesn't have to, everyone doesn't have to look like this. This is a guide for you, and if you're not tech savvy, then use the one that's provided for you, but otherwise you can make your own. And John, if those 10 boxes have headings and it all makes sense like the one does here, then I don't see a problem with that.
Thanks, Lauren. I hope that's very clear to you, everybody. As long as the boxes make sense and they have proper headings, you should be right. And Lauren also mentioned, if you're not very tech savvy, you could use the same concept map, the same format here, and just replace it with your own information on your topic. But of course, you can, and it would be good for you to develop your own map as well. So you have that choice as well. Okay. The other thing we need to talk about is, can you take a look in the boxes? You find that they are not complete sentences. They are points. So you could use dots. You could use arrows. You could use symbols, as long as you clearly convey what you're trying to say. Okay? So it's going to be brief information in these boxes. And take a look at the numbering, 1, 2, 3. What do you think these numbers relate to? Could you type in the chat box, please? References, that's right. So for example, if number 1 is a reference by Jones, 2018, as you can see, there's no space for you to type in the whole thing, Jones 2018. So you just put down number 1. And then in the reference list, you start a new page, put the title as references, number 1, and you put the full reference in APA style for Jones 2018. If number 2 is, say, for example, Andreessen and Wolf 2017, so you just put number 2, and in your reference list, you'll put down the number 2 and put the full reference. Now, the referencing here is a little bit different. So when you do the concept map, immediately after the concept map, put down all your references numbered for the concept map alone. Okay, so concept map, new page, title references, and put down the numbered references for the concept map. Then you have your question answers and put a new reference list for your question answers. No numbering for the question answers, okay? That will be as you normally do your reference list. It's just for the concept map that you're going to have the references numbered. So I repeat, concept map, reference list for the concept map, numbered 1, 2, 3, etc. Then you have your 3 questions and the reference list for those 3 questions. There you cannot use numbers. Now, if you understood referencing requirements, can you raise your hands, please? Okay, thank you, everyone. Lauren, there's a question from Melinda. She says, do we need risk factors?
Yeah, and I've just typed an answer
there. Okay, there you go.
So rather than risk factors, I think what makes a little bit more sense there is when you're talking about atopic asthma, you might want to include triggers in there and what might trigger somebody in having an asthma attack.
Thank you, Lauren. Okay. And remember, everyone,
Melinda. She can write back later. Keep going, Susan.
Thank you. Okay, everyone, remember the concept map is 250 words. Are you viewing the PowerPoint, Lauren?
Yes, I can see that.
Okay. Okay, everyone, you know there's a case study given to you, so please read the case study on Jackson Smith and then answer the 3 questions. The first question is, it's worth 650 words. By drawing on the information from the concept map and providing more information. So remember, you have your template, then you inserted some information in the concept map. Use those 2 sources, so use the information from there, but you might find that you may or may not need additional information. So use the information that you have and answer the 3 questions. The first question is, explain the pathogenesis causing the clinical manifestations with which Jackson Smith presented. Relate the pathophysiology back to the case study. So you need to keep relating it back to the case study. So you need the words, you need to mention Jackson Smith. So in the case study, or based on Jackson Smith's situation. So you need to relate it back to the case study. In addition to in answering question 1, in addition to explain the process, you will need to use cause-effect language to explain the pathogenesis. Now, Lauren will talk about that shortly, but what I'm trying to say here is when you're explaining the pathogenesis, you find that you need to use cause-effect language. For example, allergens could cause the release of inflammatory chemicals, which may lead to changes. But you need to vary the use of cause-effect language. Otherwise, when you read your assignment, you find that you constantly use the words cause, results in, leads to. Causes, leads to. So we don't want that to happen. So vary your choice of words. I'm going to just show you a brief slide here. Okay, so when you're talking about pathogenesis, if you want to talk about causes, use some of this language. X causes, or X is the main factor. X happens because of. X occurs since. X gives rise to, or on account of X, owing to X, etc. Would somebody like to type in the chat box, use one of these phrases that I've outlined for you, and can you, I don't know how you frame it, write about the pathogenesis, one sentence, just to see if you've got what I mean. X causes, or use on account of X and continue the sentence. On account of what? Menas, if somebody is having trouble logging in, please ring IT and give the meeting ID number. The meeting ID number is 392-862-541. Okay, Menas, tell your tell your friend to call IT and quote the meeting ID number. Does anybody want to type in the chat box a sentence about pathogenesis? But I'd like you to use the language that's provided here. John, do you want to have a go? Nobody wants to, Lauren, so we'll just proceed. Bayan says, okay. There you go. As a result of compromised respiratory system, yes, what happened? Something happened. Is that right, Lauren?
Yep.
Okay, so use some of the language that's on this slide. If you're talking about effects, you might use words such as a result, consequently, therefore, accordingly, thus, etc. So refer to these slides. Now going back to question 1. So explain the pathogenesis causing the clinical manifestations with which Jackson Smith presented and relate the pathophysiology back to the case study. I'm going to hand over to Lauren now, who might give us some advice on content.
So I need to refer you back to the case study all the time. So the case study has the information that you need. So when you're talking about the pathogenesis, you need to relate that back to the clinical manifestations or the signs and symptoms that Jackson is presenting with. So you might want to say, Jackson presents with hypoxia, and we know that because he has a pulse oximetry as well as arterial blood gas. I then could go on to say, hypoxia during acute severe asthma is due to, and then you explain the pathogenesis behind that. So you can group your clinical manifestations together. So I said that pulse oximetry and arterial blood gas, they give you the same, different information, but point to the same thing. You might want to say, you could start by explaining the pathophysiology. So you can go the other way around and say the inflammatory process, etc., is a response to, and you can fill in the blanks there, which has resulted in Jackson having the following signs and symptoms. So you can either go by starting with the signs and symptoms, group what's related together, bring it back to the pathogenesis, or go the other end and talk about the pathogenesis, and then how Jackson is displaying the signs and symptoms that are caused by that pathogenesis. So you can either option is acceptable, but please cover each of those clinical manifestations that has been provided in the case study. So what else have I said here? So hyperinflation is related to increased in expiratory resistance, which equals, and then you can talk about reduced expiratory time, and then CO2 in the blood gas, how is that affected? Sorry. How is the CO2 affected? You know, so you link back, you can link back a couple of the different signs and symptoms, but make sure you cover all of them and always relate to Jackson. So you don't need to talk about other signs and symptoms that aren't there, although they may relate to acute severe asthma in an adult, but please explain each of the ones that have been included in the learning guide.
Thank you, Lauren. That was a lot of good information from Lauren, everyone. I hope you follow her advice. Lauren, there's a question from John here. Is the ABG reading considered a clinical manifestation?
It helps to explain the clinical manifestations. So, and yes, I would talk about that. You don't have to go into a lot of detail because it is a bit of a tricky concept to understand. But if you can talk about the oxygenation as well as the CO2, then that's a really good start.
And Melinda, do we need to discuss his blood gas results as part of manifestations?
Yes, that's the same question.
Okay. Do we need to go one by one with clinical manifestations? You covered that as well?
I think that I covered that in what I was saying. So you can group the related ones together and then answer that as a group, but make sure you mention them in the same sentence.
Thank you, Lauren.
You're welcome.
And Gurpreet, thank you for typing in this little example. She's written, dyspnoea is due to inflammation and airway obstruction. Now, I won't know content-wise, but she has used the language of cause and effect, is due to. So this is what I meant, everyone. When you answer this question on pathogenesis, you will find that you need to use a lot of cause-effect language. And I showed you the cause-effect language that you need to use. Please refer to those slides when you're writing that answer. If not, you'll find that you're constantly repeating yourself. Okay, are we all okay with question 1? Hands up if you are, so that we can move on to the next question. All right, thank you, everyone. Lauren, we now have 23 students with us, which is good. Okay, question 2, 300 words. Discuss 2 high-priority nursing strategies to manage Jackson-Smith and provide evidence-based rationales for these strategies. So you need 2 high-priority nursing strategies, and you need to provide rationales. What do we mean by rationale? Can you type in the chat box, please? What does rationale mean? Not yet? All right, everyone. Rationale means reasons. So you need to give the first high priority strategy, describe it, and give reasons why this strategy needs to be done. Then you talk about the second high priority strategy and give reasons why this strategy needs to be implemented. Is that right, Laura? Okay. And it says here, your unit coordinator actually asked me to put this note down the bottom. Should focus on nursing priorities, not on pharmacology. So I might hand over to Lauren now to explain a bit more about that.
So the nursing priorities, we're steering you away from talking about pharmacology, and Joan talks about this in the video that she's put up for you as well, because you're going to be answering that question in question 3. So rather than repeating yourself and only being able to have marks allocated once for including the same information, include something different. So yes, Anisha, oxygen therapy would be a really good one to include. And well, rather than me answer it, I'll go to Susan's strategy. And can you tell me some nursing strategies that you might have? Can you type some nursing strategies in for me? Positioning, yes, I would include that. Anything else?
Okay, everyone, you need to type in the chat box. This is to help you, okay? It doesn't matter if you get it wrong. Lauren will tell you if you're on the right track. So please type your responses in the chat box.
So oxygen is a drug, you're right there, Anisha, but it's not one of the drugs that we're talking about in question 3. So by all means include it in this part of the priority, monitoring oxygen saturation. So somebody said before, can I scroll up here? I can. Somebody said before vital signs. So vital signs is important, but why are you including vital signs? Vital signs need to be included because you are monitoring the effects of the drug or you're monitoring the patient. So include vital signs as well as more of a physical examination. So you might want to include that in having listened to somebody's chest, and in seeing if you're going to include oxygenation, how has oxygenation been, how has that improved Jackson? So if I was talking about oxygenation, I would say that oxygenation, you give oxygenation as your example, and then what would you expect to see with giving oxygen to the patient? Same with positioning. Why is positioning a good priority for Jackson? So talk about, the physiology of the patient and how setting somebody up is actually going to improve their lung space and things like that. So give reasons why you're going to do it.
And there's a question here from Gurpreet Lauren. Do we have to describe which mask we are going to use and how many letters for oxygen therapy?
Yep, so I would include what device using how many litres of oxygen, and then I would rationalise that. So why am I going to give, either 2 litres via a nasal prong, or why am I going to give 6 litres in a Hudson mask or a non-rebreather? So tell us why, let us know how clever you are and what reading you've done, and rationalise what oxygen you're going to give rather than just say oxygen. Definitely, that would be good.
And there's a question from Cecilia that I don't understand. She's just
so that's that would be describing the signs and symptoms. So you could monitor that. So you could say that you're monitoring dyspnea, but dyspnea itself is not a strategy, is it?
Thank you, Lauren. I think we're getting some good responses on the chat box as well. So I might save the chat and put it up on views for others to refer to, if that's all right.
Sure.
Okay. Do we have discussion board in this assessment? I'll have to check with Lauren.
I don't think there's a discussion board available.
Yep. Thanks, Lauren. So everybody, 2 high priority nursing strategies. So you might start by saying, for example, 1 high priority nursing strategy is, name the strategy, and then give the rationale or reasons. Okay, a significant reason for this strategy, a main reason for this strategy is, and then give referenced information with reasons why the strategy is important. Then you go to the second one, etc. I think Lauren is responding to Gurpreet's question, so I might go on to the next slide. Question 3. 3 of these drugs that were given to Jackson were continuous nebulized salbutamol, nebulized ipratropium bromide, and hydrocortisone. So these are the 3 drugs, and you have 2 parts to the question here. A, discuss the mechanism of action of these drugs. That means there are 3 drugs. So what's the mechanism of action for each of these drugs? And relate to the underlying pathogenesis of an acute severe asthma. B, describe the nursing implications when administering these drugs to a patient with an acute severe asthma. So I might check with Lauren in terms of content for question 3. Lauren, please.
Sorry, I was typing.
That's all right. I know.
Question 3 is really simple, and it's probably going to be the question that is easiest for you in terms of gathering information. What's going to be hard is getting it into the 300 words. So all the information you'll be able to find online, and this is just you being again relating it back to Jackson and why you're going to give these drugs to Jackson, but not straight from MIMS, but start with MIMS, see what information it gives you about these drugs, relate it back to why giving it to Jackson, and that's pretty much a no-brainer with this. You only need to discuss the drugs that are there, and you don't need to add anything else into that.
Thank you, Lauren. There are a few questions on the chat box if you'd like to verbally address them, Lauren.
Can we write the mechanism of action for each drug in 3 paragraphs? Jessica, do you mean the mechanism of action being the same for all drugs? Can we write the mechanism of action for each drug in 3 paragraphs? So as in having a paragraph for each drug, yes, that would be appropriate to write 1 paragraph for each drug. You've only got 300 words, so 100 word for each drug. Try and split that up. If I haven't answered your question, then write back again, Jessica.
And I think Mena's had a question. Rehabilitation can be one of the strategies.
Again, I'll address everybody. Is that a high priority nursing strategy? So, if someone presents and they're really, really sick, are we going to talk about rehabilitation straight away, or are we going to have high priority nursing strategies that are going to save their life so they can be rehabilitated later? Because if we're going to start talking about, what should be done on discharge, we want to be able to make sure the patient's well enough first. So things like, rehabilitation and increasing exercise tolerance and things like that, I would wait and myself not think that would be a high priority nursing strategy. You need to think first aid first before you're going to fix all the other things. So 300 words for the question. I'm just going to bring the learning guide up so that I don't say the wrong thing. Question 3, the drugs, 300 words altogether. So 3 drugs that were given to Jackson were nebulized salbutamol, so 2 nebs and hydrocortisone. So you've got 3 drugs, and however you split that up is up to you. There's no right or wrong answer, as long as you can answer the question within the 300 word limit.
For A and B, is that right?
Yeah, correct.
Yep.
So if you do the maths, it's 1250 altogether, and that is the 650 for question 1, 300 for question 2, and 300 for question 3.
So John, it's not 300 words for question 3A alone, okay? It's 300 words across A and B.
Correct.
And there's one more question from Alec.
Okay, and temperature, level consciousness. For question 2, monitor skin colour, temperature. So that is monitoring the patient's condition. Yes, you could talk about that. Being careful not to repeat what you've said in question 1. So monitoring a patient, so some people think monitoring is not an intervention or a nursing strategy. So the way that you address that needs to be as a nursing strategy. So you're monitoring the patient and you're looking for particular things for the patient which you've said, and you're doing this to prevent the patient from getting worse, or you're doing it to be able to see that the intervention, the drugs are actually improving your patient. So I think that monitoring is a nursing strategy, because we're not going to give a drug without seeing if it's addressing the problem.
Thank you, Lauren.
You're welcome.
There's a question from Jessica.
Yeah, so physical examination. So that is, I guess, the same question from Alex. And I would say yes, that physical examination as an assessment tool, because you're assessing, as I just said, you're assessing the drugs that you've given, or you're assessing sitting a patient up, or you're assessing oxygen saturation. I'll double check with Joan, and I will make sure that I put the actual question is physical examination considered a nursing strategy for question 2, I will contact her and put that up as an announcement so that everybody knows if it's a yes or no. But I mean, I can say I consider it, but I'll just make sure that Joan agrees with me.
Thank you, Lauren.
You're welcome.
Everybody, Lauren has given you lots of good information. There's also a resource on your view side. Lauren, do you want to bring up the handbook, or do you want me to just scroll down, and what would you like to do?
You can, the asthma handbook is a really good tool for you to use. It's got some, just make sure that you're talking, the asthma handbook has lots on children. So we're talking about Jackson, who is an adult. So you need to talk about an adult with acute severe asthma. So don't worry about the children part of it.
So they might even look at the index and look at diagnosing asthma in adults and go to that section. Is that right, Lauren?
Look, it's not a very difficult book to have a read of. So I would flick through the whole thing and see where you might need to get some more information. It's simply written, and it might be a good place to start if you haven't started with very much of your research yet, and it gives a bit of a overview of what you would do with somebody with asthma and how to assess somebody with asthma and categorise them. So it's probably a good place to start, and you can most certainly use this as one of your references.
Okay, everyone, this is on your view side under Assessment 2. It's called the Asthma Handbook, I think. Australian Asthma Handbook, okay? So Lauren said this is a good place for you to start, but you might also need to look at other sources. And a few more questions, Lauren, on the chat box.
To mention spirometry and concept map or not? You can mention spirometry in the concept map if you like, but I heard Joan say that Jackson hasn't had spirometry. Somebody that's that short of breath and unable to talk in sentences, you're not going to ask them to make themselves more short of breath by doing a spirometry. So that's why it's not included in his case study that's over there. But you can talk about spirometry in your concept map. Health history can be one of the high priority. Look, I wouldn't go talking, it's not really a strategy. It's nice to know that he's been in hospital, intubated and ventilated before. Somebody that has had severe asthma and has been in intensive care is more likely for that to happen again. So it's good to know the patient gets really sick, but I don't know how you're going to beef out 300 words with getting a history from somebody. There's lots of resources about acute severe asthma, and there, if you go to your asthma week, then there's another paper that's there.
Which week is that? Do you want me to go there?
Yes, please.
So which learning modules?
Yes, please. And then go to asthma. And then scroll down. See the pharmacological management of acute asthma. That's a 2013 paper. And it talks about lots of things that you need to know about.
So they could use this article.
Yeah, that'd be a really good reference to use.
Okay. There you go, Bayan. You got one reference now.
Like Jessica's just asked, do we need to mention that we have to assist him into the resus room and positioning the foul in a fowl's position? Yes, well, you don't have to mention that he's in a resus room. People that haven't had a prac in ED probably don't know the flow of patients, but to mention that the patient's unwell and needs to be seen immediately or needs to be seen quickly is a good thing to discuss. And the asthma management handbook does actually give a flow of patients that display particular symptoms and how long that they can wait to be seen, or what should be the progress of assessment and treatment in those patients. So Jessica, have a look at that asthma handbook, and it will tell you, you know, if somebody can wait around or if they need to be seen straight away. but to actually specifically mention resus room, not really required, because not everybody knows that.
Thank you, Lauren.
You're welcome.
All right, everyone, we looked at the concept map, we've looked at the requirements in terms of content and language features, we looked at all 3 questions in detail, and Lauren has given you a lot of good information that I hope you use. But just to recap, the concept map is worth a lot of marks, okay? So that could be the difference between pass or fail for you. So please put in a lot of effort in the concept map. It's 250 words. It has to be computer generated. Use the side headings that are on the template, and you can personalize it to fit your requirements as long as you clearly explain each heading. That's what Lauren said. And remember, in terms of referencing, so you do the concept map and you put numbers on the concept map instead of the in-text citation. Immediately after the concept map, you need a reference list, which is numbered, okay, to match the references on your concept map. Then you have your question answers and a final reference list in the normal APA style, no numbering. And those references will link to what you have in your question answers. I hope that's clear with everyone. Lauren also suggested a few resources that you might use. So I'm just going to the very final slide. There's lots of language. Like I told you, please use the language on the slides. And in terms of referencing, as we talked about earlier, numbers may be used to replace traditional APA referencing within the concept boxes. That's in the concept map. If you use numbers, include a reference list in numerical order corresponding to your references immediately after the concept map. And you need a final reference list at the end. If the in-text references are not replaced by numbers in the concept boxes, include one final reference list with all the references for the concept map as well as the question answers. You need to include 6 academic references. And you need 3 recent relevant journal articles. The other 3 sources could be books and reputable websites. That's what your unit coordinator requires. Lauren, any advice on referencing? Any special things to look to?
No, just follow the instructions. It's a little bit left of field with having 2 reference lists, so that's not normally required from you for assessment tasks, and nor is the numbering sequence for your referencing, but follow the instructions. And so John said he has 2 reference lists. That's perfectly fine. Have 1 reference list following your concept map, so that will be in numerical order, and then the reference list for your question and answers should be in normal APA style. And that's quite all right to have 2 reference lists, even if you use the same references in both of those, or if they're a little bit different, then that's fine. No, you don't need to summarise the concept map. Asthma Australia website is not an academic reference, no, but the Asthma Handbook is. So John, hopefully I've answered your question. It's difficult to find references. Well, it's not, try and type in acute asthma and then also add acute severe asthma when you're searching through the different databases. Start with Google Scholar and then refine it down to the other databases, and hopefully you'll be able to find stuff on acute severe asthma. If you find something on acute severe asthma, have a look at their reference list and then go from there, because they've obviously used somebody else's work to write their work, and you'll be able to find other references that way. How many references do you need for the concept map? I don't think it actually says specifically how many references for each part of the questions, and it's 6 altogether. If somebody else can see that it says you need to have a particular amount for the concept map, then let me know, but I don't think it actually says. Yeah, there's no reference list reference number specifically for the concept map. I don't think. If I'm wrong, let me know. And I have just heard back from Joan, and she said that using physical examination is appropriate for your nursing strategy, as long as you again relate it back to respiratory assessment. So you're not going to be doing, you know, a limb assessment on somebody that's coming with acute severe asthma, and again refer it back to the patient situation, refer it back to Jackson. And is there anything else that you said? And asthma physiology. So, you know, you're going to auscultate the lungs to assess a wheeze. So that will be that could be one of your nursing strategies. But there are many. So don't think you have to have the ones that we've said today. If you find another one and can justify that, then by all means use it. If you're not sure, then ask your tutor.
So 6 academic references, everyone. 3 journal articles, and the other 3 should be books and reputable websites. And there are a few comments that you're finding it difficult to get sources for this particular assignment. Even if you go into the library and ask the librarians to do a literature search, you know, search on that particular topic, I'm sure they will be able to assist you in selecting some sources. So that's another source of help as well. I think that's about it. Lauren, any further instructions?
No, Zara, referencing suggests we need to use at least one evidence-based source. I'm not sure where it says one. You need to use more than one evidence-based source. It just needs to be in one final reference list at the end. So you need to have 6 references and 3 as evidence-based. I'm pretty sure that's what it says. Some races say we can use nasal prongs. Well, you need to find, Jessica, with the nasal prongs and Hudson mask, see what refers to acute severe asthma, have a look at Jackson's signs and symptoms, and then rationalise why you have chosen whichever method of oxygen supplementation you have chosen. So I would be relying more on one sentence that says in asthma you need to have this. Have a look at your patient, have a look at the signs and symptoms that he's displaying, and then rationalise why you've made that choice.
Zara, all your sources like journal articles, books and reputable websites are all evidence-based sources. So think about your references like this. You need to have 3 journal articles, and the 3 other sources need to be a mix of books and reputable websites, okay? All right, I think we got the message across, Lauren.
Hopefully.
I will put up the webinar today and I'll send you the link. Do you want the embed code or the link, or send you both? Oh, no, I'm supposed to put it up. Yes, I'll do that and I'll tell you where I put it up.
And so this week in class for the Campbelltown and Liverpool students, sorry, not this week, next week in class we'll be going over asthma. So Parramatta and Hawkesbury have already covered a lot of this information in their tutorial. This week for Campbelltown and Liverpool we're going to be covering that this week. So it would be really beneficial for you guys to turn up to class this week as we go through the pathophysiology of asthma.
All right. Thank you very much, Lauren, for your time.
If you have any more questions, ask your tutor, and then if the tutor is unable to answer your questions, then please do come back to myself or your campus coordinator and Joan as a last resort. Please have a look at the video that Joan's put up for you. There are many, many resources available for you, and have a look at what's available before quickly getting on the email and shooting off an email with a question that's been answered elsewhere, because I know myself, I will refer you back if the question has been answered in another podcast. So good luck, everybody.
Thank you, Lauren. And in terms of literacy, you can bring your assignments, as you know, to literacy tutors on your home campus, okay? So good luck, and I hope all of you do really well. Thanks so much, Lauren. Thank you, Marion. Bye.
Bye.